Hi everyone, welcome to another edition on Health Talk with Fifi, and today we'll be looking at leukemia, cancer of the blood. My name is Adjoa Duma Ansa, and once again I have with me Mr.
Answer.
Welcome once again to Health Talk with Fifi, and today we are looking at leukemia. So let's discuss what leukemia is about. What is there any food I eat or anything I do that will lead me to have leukemia? Can I transfer leukemia to someone, and can it even be treated? So first of all, let's look at what leukemia is.
So first of all, I'll thank your lovely viewers, and let's move straight to the point. Leukemia. Now, leukemia is cancer of the blood for short. But where does the blood comes from?
Okay.
You get it. So the blood comes from the bone marrow.
Okay.
So when the bone marrow is producing abnormal red blood cell or blood cell, we term it as leukemia.
Okay. Okay. So my bone marrow, which produces the red blood cells,
Or the
or
blood
the
cells.
all the blood cells, white cells, red blood
Yeah,
cells. So if it is producing abnormal blood cells,
yes.
or sometimes immatured blood
Blood
cells.
cells. So you see it as there is a clot in your bloodstream. Instead of being the blood cells, you will be having abnormal biconcave, you'll be having abnormal blood shape.
So sometimes too, the overproduction of the abnormal cells, it will lead to crowding of the normal cells. So instead of doing good to the body, it's now harming the body. It's like attacking the good ones. The abnormal ones overshadows the healthy cells or the healthy blood cells, which tend to rather hurt the body instead of.
On a normal note, no, on a normal thing, the blood, all the blood cells should move freely.
Okay.
You get it.
Okay.
So when there is a blockage in the blood vessel and the blood begin to compound, they try to crumple. You get it. Yeah. So they turn as tissues that will even affect your heart as well, because the blood goes to your heart, brings it back to it.
And with this leukemia as well, there are types.
Yeah.
So you can have the bone marrow producing cells that are matured but they are abnormal. That one is the acute lymphoblastic leukemia. So whereby the cells producing are mature but they are abnormal. So it normally occurs in kids or children. Then you can also have, they are producing immature cells, more immature cells. That is the chronic lymphocytic leukemia. Then you can also have the acute myeloid leukemia and also chronic myeloid leukemia. So these are the types of leukemia and what leukemia is about. So we look at what actually causes leukemia. What will cause my bone marrow to start producing abnormal blood cells, or will produce a mature blood cells, but it is abnormal, or will produce an immature blood cells for me. So what will cause?
So you see, the causes, we have main two causes, but there are other factors. But we have main two causes. One is genetics. It's like being transferred from parent to their offspring. And the other one too is infection. Like infection, your body is trying to autoimmune.
Infection. Okay.
Your body, you have infection. Your body is trying to fight back and get confused and started attacking
the good cells or the strong cells,
the better cells
in the body. Okay. So we can also look at you exposing yourself to radiations or high levels of substances like benzene. So when you expose yourself to certain chemicals, you can also put yourself, or you put pressure on your bone marrow to produce abnormal cells or produce immatured blood cells. Now, is there a particular food or is there a habit that one does which puts the person at risk or to have leukemia.
Oh, okay. So, talking about habits, you see, because we say it's hereditary or infection or the
Okay.
autoimmune response that causes this blood cells to uh, lysis during a short period of time. What we say is that there is no particular lifestyle. You just need to prevent yourself from having this
Okay.
infection. That will trigger the body to fight back and cause this kind of cancer in the blood. Because when your body is trying to fight back, when your body is trying to fight back, or the white blood cells, or the white blood cells try to fight back, they get confused.
Okay.
They start attacking your tissues, and we know blood is a tissue, so they try to attack your tissues. Then the leukemia can set in.
Okay. Now we'd like to look at the symptoms. If I have leukemia, if one has leukemia, what are the symptoms the person will experience, and what are the signs that one will see that this person is indeed suffering from leukemia?
So we have the pale skin, we have fatigue, we have weak. You feel tiredness, and just so on and so forth. So
Okay. So aside the person being fatigued, you can have a swelling of your lymph nodes. Your lymph nodes might swell, sometimes fever or loss of weight. All those can contribute, and you could see that one is having consistent infection. If it's a child, you realize that your child is having a consistent infection. You keep on sending the person, your child to the hospital, and he or she isn't responding to treatment. So that can also be a symptom, or it can also be a sign that the person is suffering from leukemia. Now, I want to know how leukemia is diagnosed before we can say one is having leukemia or one has a blood cancer. What are the things that we do in our health system?
okay. So since it relates with the blood, what we do is that we take the blood cells and we look out for clots
Okay.
in the blood. So sometimes we look for a hormone test called D-dimer.
Okay.
That one is for blood clotting.
Okay.
You get it? So when the blood is clot, we see that no, there's a problem at first. Then we go to the red blood cells to watch if really they a normal blood shape, it's oval, like it's round, a bit round. You get it? You seeing abnormal shapes and you seeing it under the microscope like crumpled, then it means you're having a problem.
Okay. So you are saying that we do blood tests,
Yeah.
clotting factors, we do that as well. We also do the microscopic examination of the various blood cells to see if there is abnormal shape of the cells or any nature of the cells which is not normal. Then we can say one has leukemia. Can leukemia be cured or treated?
Sometimes I would say no, it cannot be cured. But you see, anything about cancer, when it's been detected early, we
Yes.
can do something about it. But if we don't see it early and the blood that is produced is more than what we can handle, then we can't do anything about it.
So as
There's
you
no
said,
way to manage it.
as you said, the early detection is very
Very,
important.
very important.
So when we detect the cancer earlier, we are able to do something about it. And with leukemia, it will depend on the stage you are.
Yes.
If you are in the first, second, third, fourth stage, that will determine the type of treatment you'll be
we give to
given.
you.
So it could be chemotherapy, immunotherapy, targeted therapy or radiation therapy or any other treatment depending on the stage of cancer or of leukemia you
Leukemia,
are
yeah.
in at that particular moment. So that will be all for leukemia today. And do you have anything to say to our viewers or any?
Oh, just be safe and keep praying so you be safe from such diseases because I would say yeah, 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 like, yeah,
Of
yeah, yeah,
course.
yeah. When you go to these health centers, seeing people who are sick, then you know that no, yeah, yeah, yeah. So
And
be careful out there.
I would also say that as parents, we should monitor our kids when growing up. You should know how your kids behave. So in case there are changes, it will put you at state to take your child to the nearest health facility for proper management and examination. Thank you so much for staying with us on another episode on Health Talk with Fifi. I hope you've learned a lot today about leukemia and we put all those measures in place. So this has been Health Talk with Fifi. My name is Ajua Duma Ansa, and we'll see you same time next week. Goodbye.